Greetings, friends. So, today there's a journey of a young boy. He's a teenager and he came to me with a problem of knock knees. His parents were concerned regarding the deformity. It was not just a cosmetic issue, he also had functional issue, that is, while running and while doing sports, he had his knees rubbing together, which was hindering his day-to-day activities. We got his x-rays done to assess the growth left. We got a long film x-ray, which is a scanogram, to assess the deformity.
Guided growth surgery is a procedure that temporarily or permanently delays growth at the growth plate to normalize or even out long bones. Your care team will use your growth charts to estimate your future growth and determine what type of surgery is best for you. Guided growth plates, which are figure 8 shaped metal plates about the size of a paperclip, are used when the growth of a limb needs to be slowed or stopped temporarily. These plates work by spanning the growth plate and locking the bone on either side in place. For a limb length discrepancy, plates are positioned on either side of the longer limb. This locks the growth of the longer limb, allowing the shorter limb to catch up over time. For an angular deformity, plates are typically positioned on one side of the growth plate, allowing the other side to continue growing and correct the angle over time.
So we planned for the growth modulation in this boy, and we went ahead with 8 plate hemiepiphysiodesis of distal femur medial physis. Means the 8 plates were put on the inner side of the thigh around the knee, and he was able to walk a few hours after the surgery with the help of a stick or a walker support. He was discharged within 2 days. At home, he was walking independent. He was climbing stairs. He climbed up to the 3rd floor of his house. His wounds healed beautifully within a few days, and he was even running at our center when he came for follow-up after 3 days. Since he was living abroad, he went on to lead his normal life, doing sports activities and even recreational activities without any pain. He came for follow-up after 3 months. We again assessed his alignments. We went ahead with doing a long film x-ray as well, which is a scanogram to assess for any growth and deformity correction that has happened. We could notice that partially his deformity had corrected within 3 months. So we let on the growth modulation to happen again. He went on to play sports and continue with his school, and on completion of the deformity correction, after few months, we planned for the implant removal.
Follow-up surgery will be needed to remove the plates and screws. Your surgeon will use imaging and your estimated growth to determine when the plates need to be taken out. Once they are removed, your limbs will continue to grow.
On removing the implants, he was able to again walk without any problem after the implant removal, and this is at 9 months we have completed his deformity correction. If you or your loved ones are suffering from some limb alignment issues, or your children have a problem with the knock knees or bow legs, growth modulation is a wonderful procedure to correct it naturally and have a normal alignment of the leg.